Hi, today we're going to talk about IV glutathione. Hi, doctor.
Hello.
What is IV glutathione? Is it a medicine, treatment, or a therapy?
IV glutathione is a molecule which is low molecular weight. Compound is made up of 3 types of amino acids: acetyl, glutamate, and cysteine. IV is a way of giving glutathione. Otherwise, apart from this, there is other methods also by which you can take glutathione. Normally also it is present in our body, but its secretion is decreased. It is in a lower quantity it has been secreted. So in an IV way, it is infused in a higher quantity and a dose.
Is IV glutathione worth the hype?
So let's understand IV glutathione, the way it has been promoted nowadays for whitening purpose, and the marketing gimmick it has been followed drastically, and too much around is happening around glutathione nowadays. Let's understand, it is not for skin whitening purpose. No dermatologist recommend use of glutathione for skin whitening purpose. Extremely important. Yes, discovery of glutathione happened accidentally for the whitening purpose, because it was given for the cancer patient after the therapy, and whitening effect was the side effects of this particular treatment, post-treatment. So whitening was all accidentally discovered. It is not approved by FDA for the use of skin whitening purpose. Let's come down to the use then, what it does actually. So it is useful in terms of lightening your skin tone, 1 or 2 shades lighter. It is a very strong antioxidant, and it is an immunity enhancer. It works on your sleep cycle. Those who have insomnia, we have seen the improvement in their increased in energy levels and all. So glutathione works wonderful, but do not expect any kind of a whitening results out of it.
What are the benefits of IV glutathione?
So if I talk about in particular, not just going into the skin, because at Arcane or anywhere, IV glutathione, I am not promoting as for skin whitening. We are not claiming it that it is going to give you any kind of skin lightening or whitening effect. It is only going to give you an antioxidant effect. It is going to build your skin immunity. So first one is definitely it has a very strong antioxidant, very potent one. It is going to work as a detoxing of your body also, extremely in terms of liver detoxification. It enhances your overall energy levels of the body. It is going to work on improve your sleep cycle. It is going to overall give you a very high energy. If you're somebody who's feeling low at energy, if you're feeling that your skin is getting dull, so it can give you slight brightening effect to the skin, but not that it is going to give you any kind of a fairness to the skin. And feel confident in your skin tone. It is extremely important. No treatment, be it a cream, be it IV glutathione, can make you fair. It is your genetic alignment.
What is the right way to administer glutathione, doctor?
Okay, so there are multiple ways to have glutathione. First, starting from it can come in the form of tablets, which is readily available in the market, the medical stores also. Second is your face washes in a cream formulation, which I do not recommend as a dermatologist, because absorption of glutathione topically is none. So do not waste your money in any formulation such as face washes and cream for glutathione purpose. Third is IV glutathione, which has the maximum effect of glutathione when we are administrating or talking about the way we should take glutathione. But yes, we should always consider when we're taking a IV glutathione that we're taking it from an expert dermatologist in a proper, safe environment. So coming down to how frequently you can take one, there has to be a proper protocol needs to be followed in cases of IV glutathione. Starting that you give a good alignment to your patient, that what purpose are we doing it. It's very, very important. Take a thorough consultation, understanding what purpose are you coming to your doctor for IV glutathione.
What are the adverse effects of glutathione?
There's no as such any major adverse effect. Few things if we consider before giving it to anybody, it is always safe to perform. So as you can see, I am taking one and comfortably talking to you also. And while you're taking glutathione, one should always keep themselves hydrated. It's extremely important. So coming down to adverse effects, since glutathione is a drug, the adverse effect can be there like any other drugs. not specifically as per se with the glutathione only. So here at Arcane, we perform sensitivity tests before performing IV glutathione. What is sensitivity test? A small amount of IV glutathione we inject onto your skin and check your sensitivity. If there is no irritation, redness, or any discomfort to the patient, then we follow up with the drip. We do not perform it without checking for the sensitivity. For second is, one should have the profile of the patient of all the parameters, major parameters like your CBC profile. We need to have your hemoglobin and your counts, your liver function test, all of that. And so it should be in a normal parameters. If either one of is deranged, then one should definitely consider before injecting glutathione to the patient. Your hormonal profile should also be stable in cases of IV glutathione. So always check for these things. There is a lot of safety profile that's there. If you follow all of those, then it's completely safe to take it.